Hi, everyone. Thank you for joining us. This is Ruth Landis, and we are the owners of Landis Emergency Training Services out of Sarasota. We are an American Heart National Training Center, and we started this business about 7 years ago when we moved to Florida, and we started this with a passion to teach CPR to bystanders because as EMS workers, we know that there's a lot of value. It really can make a difference in saving somebody's life. And so when we started that's what we set out to do, and we have actually grown into, like I said earlier, a national training center where we offer many classes, not just CPR, but we do advanced cardiac life support, pediatric life support, EMT class, which is a lot of fun, and basic first aid, that sort of thing. So what we're here today for, though, is to talk about CPR. And we have a very special guest today who is a sudden cardiac arrest survivor. He is going to share his story with you. And we all are here today to spread the word of how important it is for you to learn CPR, how important it is for you to learn how to use an AED. And his story is phenomenal. And we also have one of our medical director is here with us today who's going to share the hospital side of this and how much it matters for you to start CPR on someone. And our goal is to take the fear away. We don't want you to be afraid. We want you to be ready. We want you to be prepared, and that's where training comes in, and that's what we do.
So American Heart Association put out statistics pre-pandemic, and they have changed since then, but they haven't came out with those statistics yet. There's 350,000 out-of-hospital cardiac arrests that happen every year. This event that we're going to have Mr. Ernie talk to you about here, he is a survivor of sudden cardiac arrest, and if it wasn't for bystanders doing and knowing CPR and the use of an early defibrillation in those cases, Ernie wouldn't be here to talk to you about that. So we just wanted to make people be very confident and know that what you do as a bystander is what saves lives. It's not the EMS workers, it's not the hospitals, it's what happens before healthcare arrives to the patient when that happens. So with that being said, we're going to turn this over to Ernie.
So I want to introduce him officially. Ernie is a retired general manager from the Mercedes-Benz in Sarasota. He worked there for 40 years. He recently retired, actually, in December. And he is also a past chairman of the Manatee Chamber of Commerce. And interestingly enough, he was at a chamber event. So he is going to share with you his story. It's very fascinating. So we are honored and very thankful that you're here today. You have a great story, and I know that everybody watching today is going to appreciate your story, and we would love to hear all about it.
Well, thank you, Ruth, and thank you, Rick. I really appreciate the opportunity to come speak to you guys today.
Yeah.
So my story happened on February 21st, and as you said, I retired from the car business after 40 years. I was general manager at Mercedes-Benz in Sarasota the last 13. And I also was the past chairman of the Manatee Chamber of Commerce. And every year, the chamber has always had an opportunity to shag fly balls with the Pittsburgh Pirates.
Fun.
And we haven't been able to do that the last couple of years because of COVID. I always had to work, so I always missed out on going out there and shagging fly balls. But being retired, I said, I'm going to be able to do it this year. So I was very excited to be able to do it. Since I was retired, I joined a golf league. I was playing golf, 3-4 times a week. I was walking 5 miles a day for 5-6 days a week.
Wow.
I was really doing really well. I canceled my golf game that morning so I could go shag balls out at the Pirates Roberto Clemente Training Center out there at Pittsburgh Pirates. And so I was very excited. So I got there, the chamber, we took a group picture, and we went out on the fields. And there's 4 fields out at the Pirate City. And I happened to be on field 1 where all the major league players were, and I was so excited. I took a little selfie picture and was taking a little video. I picked up a few balls, threw them in. And I was just really excited. And next thing I know, I was laying on the ground and I was being asked, what's your name? And what's your date of birth? And I was trying to get up and I was going, whoa, what happened? And apparently I had a sudden cardiac arrest. I had no forewarning. I hadn't been sick. I hadn't been feeling like, I was having a heart attack, that I was sick, that, anything at all. Wasn't tired. I was active and everything was great. But here I was laying on the ground. And it turns out that my heart had stopped. It stopped beating. My pulse for 2 to 3 minutes, my heart had stopped beating. And luckily for myself, Dr. DeMeo from the Pittsburgh Pirates, he's the head trainer, head doctor for the Pittsburgh Pirates. Him and his staff came and administered CPR to me probably within 60 seconds.
Wow.
And they couldn't get my pulse back, and they were able to get their AED, and they used the AED, and it brought me back immediately. And I tried to sit up, and I was very fortunate to come back. But I did have my, he told me I took my last breath, and if I hadn't had the response of those individuals, I wouldn't be talking to you today.
Right.
So they took me to the hospital. Fortunately, I was coherent and I knew what was going on. When we got there, my EKG was a normal reading, and so there was a little bit of alarm there, saying, "Hey,
Right.
this gentleman just had a heart attack." But fortunately, they had the CAT team ready. They brought me in into the operating room, and I found out that I had 4 blockages. I had a 99% blockage, an 80%, and 2 70% blockages.
Wow.
So the doctors did a phenomenal job. Got me up, and within 3 hours, 3-4 hours, I was in my hospital room, and I was very fortunate
That's
to be where I was.
So, and you didn't have any symptoms?
No symptoms at all, nothing. I had a little soreness in my shoulders, but I attributed that to joined a golf league.
Sure.
And so I realized that I wasn't as good as what I was, because when you play in the golf league, you have to shoot the real scores. Yeah. And so I decided I needed to get some golf lessons. So I thought with the new swing I was learning, I thought the soreness in my shoulders was from that. But no, I felt great. I had no forewarning that I was going to faint or pass out. Had nothing at all. So there was no recollection there at all.
Okay.
So
So part of what your mission and your passion now is, of course, is to bring awareness of CPR and using in the AED. So that's more on the end of what happens after the fact, but we also want to focus on prevention.
right.
And so because you didn't have any symptoms, some things that people can do to prevent this from happening is, obviously seeing their doctor, getting routine checkups, but you weren't able to do that.
And well, with COVID happening, I wasn't able to take my physical the last 2-3 years, and I'd always got my physical every year.
Right.
And so I hadn't been able to do that. And I also had an opportunity. Former chairman Kevin DeLallo was a former past chairman. I served on his executive board, and he gave me a health screening, a free health screening to have my heart checked.
Right.
And I was one of those people that, well, I'm fine, I'm healthy, I'm not going to go get a health screening.
Right.
And I never took advantage of it.
Right.
Well, I'm here to tell you today that the screening could save your life.
Sure.
And I was fortunate, after I had my event, that Martin Gramatica of Lifeguard Imaging up in Tampa reached out to me.
Yeah.
And he's offering anybody that's listening to this video a free heart scan.
Oh, that's awesome.
And
Yeah.
you could, we'll provide the information, but
Okay.
I recommend strongly that, go ahead and get this free heart
Absolutely.
scan for you. But also go see your doctor, go get your physical. If you hadn't been doing that, take advantage of that and see your primary care physician.
Absolutely.
But my goal now, since this has happened, is I took your course at the chamber,
Right.
and learned how to do CPR and how to utilize an AED. And now I feel that my calling is to get certified in teaching CPR and teaching people how to use an AED. And I want to refer people to lifeguard imaging, so they can get their scans.
Right.
And the way that I met you, if I hadn't been where I was in that 10 minutes, I don't know that I'd be able to talk to you guys all today. And the way that I met you at a chamber event,
Right.
and how we were able to connect and be able to be here today,
Right.
it just means so much to me that we can partner together and make
Absolutely.
this happen for people. So I really appreciate you guys giving me the
Oh,
opportunity.
absolutely. And thank you, obviously, for sharing your story, survivor stories. That's awesome. And your mission and your passion now is to get this out there, not just how to save a life, but prevention, right?
Absolutely.
And then what happens if you can't prevent it? Learn CPR.
Learn
how to
CPR.
use an AED. And so we're going to get you definitely set up to do that, so you can go out and teach. I mean, who better to be taught by than someone who actually survived a sudden cardiac arrest?
Absolutely.
Right?
And I think the thing is that's important for people to know, and we discussed this, is, I was fortunate to be around some doctors and trainers at the Pittsburgh
Right.
Pirates organization. But you don't have to be surrounded by doctors
Right.
or trainers. You can learn CPR. You can learn how to use an AED.
Yes.
You could save somebody's life.
Yes.
And that's what I hope that I can help share with people, and take this event that happened to me, and be able to share that with other people.
Absolutely, anybody can do this. We have several of our students who have shared with us that it was the first time they took a class, and they've shared with us that they were able to use these skills and save somebody's life. And it gives me chills every time they share that with us. So anybody can do it. We want to encourage you. If you've ever thought about doing this, it is possible. It is easy to sign up. We can get you taken care of, and we'll definitely get you the contact information for both the scan,
Lifeguard
screening.
imaging.
We'll get you information on that, as well as how to take a class.
And Martin Gramatica is with the Tampa Bay Buccaneers, and
Oh,
he'll even take your phone call and get you registered. So you get to talk a little about
you like
little
football,
about the Bucs and get your heart screened for
Nice,
free.
nice. Well, thank you, Ernie, and it is truly an honor to have you here and to have met you.
Wow.
And we're going to be in this for a while, so
Well, thank you
Definitely.
and Rick for again teaching me CPR
Sure.
and how to use an AED.
Yeah.
And I definitely, you guys decided to do this on your retirement, and that's what I decided that I want to do in my retirement.
You never
is to
saw
be
that
able
one,
to
did
help.
you?
I did not, and I was looking for something that was meaningful that I
Yeah.
could get back to the community, and I think that this is meant to be. So
We're gonna
thank
make
you
it
and
happen.
Rick so much.
Yes.
I appreciate
Absolutely.
allowing me to take the time to share my story.
Thank you.
Thank you.
And so we are going to talk with Dr. Shah. Dr. Nishan Shah is our medical director, and he is kind of going to give us the side of what happened when you went to the hospital, right? Like the post part of it. So it is very important to do all those things ahead of time, but we also want to make sure that we can get you to the hospital, and then those doctors are able to take care of you. So we're going to be talking to him here shortly.
I appreciate it. Thank you, guys.
Thank you. Okay, so we are now with Dr. Shah. He is our medical director, and he's going to kind of give us how does it work when we get the patient to the hospital, and does CPR really matter before we get them to the hospital, before they get to even before they get to EMS. So I'll let Dr. Shah kind of tell you who he is and what he does, and he's just going to kind of hopefully make it even more.
Absolutely. Hi, I'm Nishan Shah. I'm one of the emergency medicine physicians at Blake Medical Center, and I have my own urgent care, Two Rivers Urgent Care in Manatee County. So CPR, cardiopulmonary resuscitation, is very important. And the reason why I say that is, from the medical perspective, CPR is when you start pressing on somebody's chest. And you start pressing on somebody's chest after they have collapsed suddenly and you don't know what's going on. And in many of instances, we have noticed that this event happens because the brain is not getting sufficient oxygen or blood flow. And the reason for that is because the heart has stopped beating. So every time you press on that chest, you're actually attempting to push on the heart and allowing the body to get that blood flowing. So every time you're pushing on that chest, the blood is flowing from the heart to the rest of the body, going through the lungs to the brain. And that is the reason why CPR is very, very important. We all say in medicine, time is tissue, time is brain, time is heart. And even at the hospital levels and also on the government level, the measurement of time is very important because you want to get the patient to the cath lab in a case of a heart attack as quickly as possible to open up that blood vessel that has suddenly collapsed by putting a stent in it or whatever it may be to give oxygen back to the body. So in this case, you call 911 after a loved one has collapsed suddenly and you don't know what to do, and it takes 10 minutes for EMS personnel to come and start CPR. Every patient I see that comes into the ER via EMS has CPR already started prior to arrival to the ED. But that's not what's important. What's important is the moment immediately after the collapse to the time when CPR arrives. Those first 5, 10, 15 minutes, whatever it may be, is the most crucial time because that's the time when the brain is not getting that oxygen, that blood flow. And that's what determines, whether the patient is going to survive. We can save the body, we can save the heart, but if during those 15 minutes, if the brain doesn't get enough blood flow or oxygen and brain dies, then there's no point in saving anybody when they're already brain dead. So I think it's very important that CPR be started as quickly as possible. And again, time is brain, time is heart.
One of the things we hear the most as far as why people don't want to do CPR, well, two things actually. One of them is they think they have to breathe for them. The other thing is they're afraid they're going to do it wrong, right? So we try to encourage them to know, first of all, and I would like for you to kind of talk about the breathing thing, but something is better than nothing. And so we want to make sure that you understand when you were talking about pushing on the chest, it can be a little intimidating, it can be a little scary, but from a physician standpoint, how do you feel about somebody trying something over not doing anything?
I think the most important thing is to try. Your technique doesn't need to be perfect. You just need to remember that all you're trying to do is press hard enough on the chest to squeeze the heart. And whether you're pushing here or here or here, it doesn't matter as long as you're doing something, because something is better than nothing. In terms of your first question about breathing for the individual, I know after COVID-19, everybody has been scared of catching COVID-19 or even doing mouth-to-mouth resuscitation. The new studies have shown that breathing for the patient is not as important as just simply pressing on their chest. And the reason behind it is there's lots and lots of extra air that's in your chest, lots of oxygen that's just sitting there. And the oxygen doesn't move unless the blood is moving. And every time you press on the chest, it goes down, and when you let go, the chest recoils. So it automatically sucks in whatever air that's in the atmosphere, replenishing that oxygen. Sure, if you have multiple providers around, if you have multiple healthcare, you can give them oxygen, you can put a breathing tube, you can do all of that. But CPR or the act of pressing on somebody's chest to allow for the heart to continue its momentum of beating and what it's supposed to do, and to allow for the blood to continue to flow through the body is the most important thing.
Yeah, and so in Ernie's case, he was surrounded by a medical team, but you don't have to have a medical team. You don't have to even have medical knowledge.
Correct.
What does help is if you have some training on when to act, how to act, maybe where to put your hands, and just being able to practice on a mannequin to kind of get a feel for, what
Absolutely.
CPR is like.
Yep.
And so once they come to you, like we can't always say, well, their survival chances are 100% if everybody does CPR before EMS gets there. But if they were to have the best chance of surviving a sudden cardiac arrest, and certainly if it's witnessed, right, bystander CPR can
Absolutely.
definitely increase the chances of them surviving.
Absolutely. And again, the most crucial time is immediately after the event happening.
Right.
So if somebody collapses all of a sudden and you call 911, you're waiting 10, 15 minutes for EMS to come.
Right.
And that time is very important. That time that you're just standing there looking in space or worrying, you could start CPR. And I know it's scary, but the person that is going to need it the most will be your loved one, because more often than not, it may be your mother, your father, your spouse, family member, and you're there. A lot of times it's witnessed by the family member, and that moment right after the event taking place. Learning CPR, taking a class here or anywhere, it's very important because you could potentially have 5, 10, 15 extra years with your loved one just by acting appropriately at the right time.
And also just to maybe help tie this all in, just know that when you have that situation and you call 911, those dispatchers are trained and they will walk you through every step of the way and literally just talk you through how to do it. So there's people that take classes all the time and they walk out of here and never do CPR. But dispatch is trained to do that and they will help you.
Absolutely.
And so I appreciate you coming here because it's always nice to know pre-hospital, post-hospital, and what it means to you guys when we bring patients in there, how effective all this pre-hospital work is in order for you guys to, best chance of surviving. You can only
Absolutely.
do what you can do, and I
Correct.
get that. So, but it definitely makes it better, and communication is important. So thank you for sharing
Of course,
that.
yeah. Thank you for having me here.
Yeah, I appreciate it.
And yeah, we're hoping that everybody gets this message and
Yeah,
you know,
awareness. Yeah.
awareness, and just know that you can make a difference. You don't need to be a healthcare professional.
So thank you.
Of course, thank you for having me.